Record on the cloud. There we go. Okay, Dr. Levy, thank you so much for taking the time out to talk to us today. We have questions about the COVID-19 vaccine from our staff. So why don't you first tell us a little bit about yourself?
Sure.
I think the staff all know who Frank and I are.
Okay, sure. My name's Susan Levy. I'm a geriatrician, internist. Been mostly active in my later career in post-acute and long-term care. Moved here to Delaware about 6 years ago from the Baltimore area, where I was Vice President of Medical Affairs for a kind of large multi-level campus. And wanted to remain engaged with post-acute and long-term care, and began working in a couple of the nursing homes here in Sussex County. And we'll be joining you all in just a week or two formally to take on a medical director role at Harrison House.
Yes.
The facility actually in Georgetown.
Yep. We're very excited for you to be joining us and for the staff to get to know you and you to get to know our staff. We've got a lot of people who've worked with us for a really long time, which is kind of our niche, which is nice. So some of the questions that we've had about the vaccine are that some folks are on the fence about it. I think the number one question has been, how long does the vaccine actually last? Or how long are you protected for?
Right. Part of that, unfortunately, as many of us were listening to the news, we don't know. I mean, honestly, you know, the vaccine has not been available that long for us to be able to measure how long we may have protection. But part of what we'll be doing is this vaccine's been rolled out more and more and is ongoing, is trying to look to see if specific antibodies certainly persist, but also to see what actually happens to individuals if upon exposure again, whether they get sick. So we really don't know. We do know that there's been some cases of people who actually have had COVID-19 and apparently their own immune system response to that infection was not as robust as you might have liked it. And in some relatively rare cases, there have been reinfection, but those have been rare cases. So we are concerned that we may need to revaccinate at some interval. We don't know what that is at this point.
Does that mean it's kind of like the flu vaccine where we get the flu vaccine every year? Should we be looking at it like that?
It's quite possible. And we know that this is COVID-19 is one of many coronaviruses. So there may be other coronaviruses related, just like we have different strains of flu. So that is a possibility that we may need to have ongoing vaccination. Just like over the years, we've identified and have vaccinations to other infections that have come along and have made a major impact in our ability to be able to control those.
If you've had COVID, we have had several staff members that have had COVID-19. Are they eligible to receive the vaccine? And should they?
Yes, they are. And yes, they should.
Okay.
Now, in terms of their eligibility, you know, normally that we're saying that as soon as you're recovered from COVID, and that's either the kind of 10 or 20 days you hear about when someone can remove transmission-based precautions, shorter in people probably who were less sick, longer in people who were sicker. But beyond that time period, it's totally safe to take the vaccine. And current recommendations are that will give your immune system an even bigger boost, and certainly is what we're recommending at this point.
Why is it 2 separate shots? That's a question I have.
Well, if you think about it, this is relatively novel. And so although there are other coronaviruses out there, this is relatively new strain and certainly behaves very differently. So most of us, well, we may not remember back to when we were children, but need to remember that frequently our first series of vaccinations, there are boosters that are given. You know, you don't, it's not just like you get one vaccine and you're done. You have to get repeated vaccines. And then for most of our vaccinations, there are variable periods beyond which we get it, like tetanus shot maybe every 10 years. You know, those things happen. Obviously, flu is one where we get annually to maintain our immunity against new strains that develop. But, you know, in most vaccines, there's some period of time that they need to be repeated. There's a few exceptions, but anybody who's older, and some of your employees may be, who are candidates for the Zostrix, the new Zoster vaccine for herpes zoster, again, that's a 2-shot vaccine. You know, it's something that's very doable. We're able to track those things and to reach out people to make sure they get that second vaccine.
Once you get the vaccine, can you still spread the virus? Can you be a carrier?
Right. That's why we recommend that even if you've had the vaccine, you're still going to need to be wearing the protective, personal protective equipment.
Oh, I'm glad you said that. That was one of the questions. One of the staff submitted the question, can I stop wearing a mask once I get my vaccine?
Wish I could say yes, because I know we are all very tired of wearing masks. We're particularly tired for those that are wearing N95s because they're, a little more constricting if you're having COVID in your building. So, certainly I wish I could say that, but at this point in time, the recommendation is that we still wear the appropriate PPE, like people who've not been vaccinated, or for people who've not had the infection. Even if you have had the infection, we still are having you wear full PPE.
Okay. What about, does the vaccine change or alter our DNA or have any effect on our DNA?
No, everybody hears that it's a messenger RNA virus, and then they're trying to remember back to biology if they can and what all that meant. But no, it does not alter your DNA. There's nothing you need to worry about being genetically manipulated by this.
Are you getting the vaccine?
You better believe it. The sooner the better. As soon as I find that I'm eligible and able to obtain the vaccine, I'm definitely getting it. I can't imagine anybody in healthcare who's survived the last 10 monst now, been through some of the horrendous outbreaks nursing homes has suffered in COVID-19, who would not take the vaccine. And if it's you may be afraid for yourself, but you got to think about what you're trying to do is protect your family, trying to protect the other people you work with, your coworkers, as well as the residents that you care for. And, everything else we're doing is really trying to, again, we talked about flattening the curve. It's really trying to prevent, but this is the game changer. Vaccinations would have made an incredible amount of difference in terms of improved longevity, all sorts of things over the years. So vaccines really are a game changer for this illness. And so, really strongly recommend that everybody, if they're already said no, that they rethink it, talk to people who are starting to get it. On your vaccine days that you're going to be having scheduled coming up, don't say no. Just go ahead and line up. You can always say no at the last second if you get cold feet, but would prefer you didn't. It's really no worse than the actual vaccine and getting minor prick. It's like a flu shot, and certainly the benefits. Frankly, I wish we were all able to get it before the Christmas holidays or whatever holidays you celebrate this time of year, because we could all be saying it's our gift to ourselves and our families. But it's coming.
How about side effects for people who might be worried about the side effects, and that may be a deciding factor? Right. From what you've studied or read, are you hearing anything about side effects?
This is like any other vaccination. Okay. Yes, there are side effects. And part of it is the side effects actually are often reflecting that the vaccine's working. Because, it's starting to try to get your immune system revved up. Okay. Not as bad as an actual infection. But we're trying to build antibodies against one of the proteins in the coat, that spike protein you hear everybody talk about. It's going to help that virus from entering our cells and causing all the damage that it does. So what happens to the side effects? Yeah, your arm may be sore. Some people may be a little better giving it than others, but or you may jerk when you get it. It hurts a little more. But usually sore arm, low-grade fever, the same types of things you see potentially really after a flu vaccine. There is some evidence, and this has certainly happened with the shingle shot, is that because you've kind of primed your immune system initially with the first shot, the second shot, sometimes your side effects may be a little worse. Not everyone, okay? The general expectation is by 72 hours, for the most part, those signs and symptoms should be gone. If they're not, then actually, unfortunately, we need to think about is something else also going on with you. Because remember, the vaccine takes time to work. You don't get the vaccine and say, I'm never going to get COVID. First of all, you may still get COVID, but the goal of the vaccine, just like you can still get flu after a flu shot, is to really not just necessarily prevent it, but to also make sure that it's not as serious, so that you don't end up in the hospital or in the ICU, or frankly, as we know with this is actually a fatal disease.
Mm-hmm. Absolutely. We've experienced that ourselves at Harrison Senior Living. So that's why we're being excited about the vaccine, because It has the potential to help us stop what we've been going through. one silly question, I think it's silly, but there are people that really want to know this. Is there a tracker in the COVID vaccine?
No, we're not like putting a microchip in you or anything like that. I mean, it sounds kind of science fiction-y, but that's not what's happening. Now we do track that the vaccines have been given because that's very important. We're going to have to be able to make sure that we get you back for your second vaccine. And we also want to be looking and measuring rates and seeing how getting large populations vaccinated are going to make such a incredible difference with trying to bring this disease under control. But no, there is no tracker in there. We won't be we won't be tracking you with the vaccine. No.
On a more serious note, in your professional medical opinion, do you think that the speed of the development of the vaccine compromised its safety at all?
No, actually, if you look at what they did, if anything, even for the, EUA approval, they basically had the same requirements as they would for full approval. So, because they were afraid that if they didn't do all that and make the companies developing this go through those hoops, that we were going to run into the very things that we're concerned about is that people are going to say it's too fast. Remember, even before these were released, between the Moderna vaccine and the Pfizer vaccine, we have well over 70,000 people who've received these vaccines. The side effects, there are side effects, we track them. I'm going to tell you, I'm not going to tell you nothing, but certainly not everybody. And the side effects are relatively mild. And as we all know, sometimes when you look at the groups of people who got what's called the placebo, they didn't really get the vaccine. They also have reports of side effects. I mean, right now, on a lot of days, I have a headache. I have a lot of reasons to have headaches these days. We all do. So, we look at those side effects, but really in reality, the question sometimes is, are they really that much more prevalent? But we still report them, so you're prepared for them. So I think that, really, I just can't, try to encourage people enough to not be afraid of this.
I think you answering these questions is very helpful. We have 2 more questions submitted from the staff. One of our team members is allergic to bees and carries an EpiPen. Should they not be taking the vaccine because they are allergic to bees and have an EpiPen?
Well, actually, there were some concerns initially about delaying vaccination in people who have significant serious allergies. Certainly, if you have allergies to the component of the vaccine, which is not a bee sting, okay, because a lot of people are allergic to bee stings, that should not be an issue. But we also know people who seem to be allergic to everything, any drug they take, anything else they take. And those may be folks that I would certainly, if I choose to vaccinate, would certainly make sure that I watch even longer. Currently, right now, the expectation is that you be observed for 15 minutes. Remember, we're being super cautious with this vaccine,
right?
Because we know how concerned people are. We want to reassure them that we're going to be there if there is a problem. So right now, the recommendations are generally, observation for about 15 minutes. If you've had histories of allergy, we may increase that to about a half an hour. And remember, all of our facilities, the advantage that there is in all of our facilities, we really are equipped to handle medical emergencies. I mean, we do it.
Yep.
We do it all the time. So if she's got her EpiPen kit and she's nervous, bring it with her. But we also will have in the building epinephrine, Benadryl, steroids, anything else we would need to treat any kind of life-threatening, and people hear about the anaphylactoid reaction.
Yeah.
And I think, what they've also heard is that in the extremely rare cases where it's occurred, all of those have been very successfully treated.
Okay.
And usually, even with as bad as it seems, most people with an anaphylactoid reaction go home that day. They go home maybe with some medication. Occasionally, because of out of precaution, they may be observed overnight. But and those are pretty rare considering now, we've been giving this vaccine now for week, 10 days, longer. We have many more people who've been vaccinated, and we're really not seeing overwhelming numbers of serious side effects.
That's positive and very reassuring.
Correct.
How about our team members that may have pre-existing health conditions? Are there any pre-existing health conditions that make you ineligible to receive the vaccine?
Offhand, and I could be missing something, and I'm sure when they go to give you the vaccine, they'll run through that list again.
Right.
But it really more is actually allergy to the components of the vaccine. So let's say you had a very serious reaction to the first vaccine, I probably would not give you the second booster.
Okay.
Or certainly would have to really give that some serious thought and maybe want to do it in a little more supervised environment. That would be, one example. Someone who actually had a reaction to the first vaccine, I probably would not give the second shot to. But for the most part, frankly, it's the people who really have underlying health conditions, even conditions like hypertension, diabetes, that may be well controlled, but we know that that puts people at higher risk of bad outcomes from this illness. These are the folks who end up getting seriously ill, getting hospitalized, getting hypoxic, and unfortunately sometimes have to be on a ventilator and sadly can pass away.
Is there anything else that you wanted to share with us? I think I hit all the questions from our team.
No, I think given that a number of, we have a large female population, sometimes a younger population, is that you sometimes may have a concern with pregnancy. What I always encourage women who think they could be pregnant or are pregnant is always check with your OB for anything that you do, whether it's taking a Tylenol, just because they know your history so much better. But there really is no contraindication. In fact, we're concerned about pregnant women and the risk should they get COVID. To their future babies. So again, that's a conversation. If that's the case, I would start having that conversation now with your OB and get their reassurance. And so I think that certainly is extremely important. There is one other thing, which is tough because we're in a time frame, and again, we're juggling a lot right now, but we're in a time frame where COVID's fairly prevalent in the community right now. We read those reports and watch those numbers. So a lot of people keep saying, well, can I get COVID from the vaccine? You do not get COVID from the vaccine. It is not a live vaccine. Now, I can tell you that it takes time to build the immunity. So if you've been exposed, yes, you could develop COVID the day after you were vaccinated, but it has nothing to do with the vaccine. It has to do with the fact that you were anywhere in that prior 2 weeks exposed to someone who transmitted COVID to you. Now, it can become a little tricky for us, which is why I want to make sure people are educated about the side effects, because some of the side effects you get from a vaccine you could start thinking, gee, is this COVID? Normally we look at the time frame and the types of side effects. The vaccine side effects are you don't lose your taste and smell. So those are things that would make me say, if you come in 2 days after your vaccine and you say, I've got all these symptoms and I've lost my taste and smell, I'm going to say, you got exposed to COVID, we need to test you. So I think that is another thing that's important. So, you really just need to look at the timing of the vaccine and then when those symptoms develop.
Okay. Kind of like the flu vaccine.
Everybody always say, I got the flu vaccine, I got the flu.
Right.
There's some respiratory illnesses that circulate potentially this time of year, which fortunately, many of them are not as contagious as COVID is, because we all remember back in the beginning when they told us about it was 3 times as contagious as flu. And who knows, that may actually be changing in some areas as the virus changes itself. So it is certainly more contagious. So we think that a lot of these efforts we're doing, so lessons learned for future years in terms of dealing with respiratory outbreaks, is that the efforts we seem to be taking in terms of wearing PPE, socially distancing, washing our hands, wearing masks, actually is probably helping to keep flu under control this year, which, knock on wood, is really what we need to do, because we certainly don't want to have to deal with both at the same time.
Agreed. Well, thank you, Dr. Levy, so much for your time. I think this was really helpful, and I look forward to sharing this with our team. And if you have any questions for us, you can always reach out.
No, looking forward to coming on board. And certainly in the meantime, if you have other questions that staff, certainly feel free to shoot them to me. If I don't have the answers, I'll try to research and get the answers for you. And again, with all of this, we do realize things do change. The thing that's important is we're going to be super careful in the beginning about giving this. And, frankly, probably by 8 to 12 weeks from now, it's going to be no different than, lining up for the flu shots like we all do every year, or should do every year. And that is the one other thing I will remind your staff. You should have gotten your flu shot. You need to time and get your flu shot. Those things are certainly important to do, because again, we do know that flu does circulate out there. Right now, particularly, I am focused on you getting your COVID vaccine also. So thank you very much. And I hope everybody has good holidays.
Thank you. You too, Dr. Levy. Have a great rest of your day.
Okay. Stay safe and healthy.
Thanks, Frank.
Bye.
Bye.